1370 AM, 96.3 FM, The Source.
All right, 18 minutes after 11 o'clock. Nice looking Thursday. Hope you're doing well. We're going to learn a little bit about diagnosing and treating lung cancer. This is something that is very close to you, Robin. For those who don't know, Robin's husband had lung cancer, had a whole lung removed.
Yes.
And is doing well. And that's
7 years.
That's the good news. Sometimes a bad diagnosis doesn't necessarily end up to be bad. In 7 years, that's a long time. Mm-hmm. Dr. Gilberto Lopes is on the phone. He's a medical oncologist and the medical director for international programs, and he's the associate director for global oncology at the University of Miami Sylvester Comprehensive Cancer Center. I'm a little confused about his guest. I think it's Sandy Baza, but I might have the wrong name. We'll find out right now. Dr. Lopes, good morning, and thank you for being on the show with us today.
Hi, Larry and Robin, and I'm happy to hear that Robin's cousin is doing well. We have Maria Ursula with us here today, coming from San Francisco.
Okay, Maria. Good morning, Maria. How are you?
Hi, good morning. Good morning. Good, thank you.
And how are you doing physically? You have lung cancer or had lung cancer?
I have. Well, I am stage 4 lung cancer right now.
Stage 4.
Oh my gosh.
Oh my gosh. All right. And doctor, what does that mean? When we hear somebody say stage whatever, what does that tell us?
So stage is the second most important thing we want to know when we have a diagnosis of cancer. The number one is the specific type of cancer that you have, and the stage tells us where the disease is. If it's stage 4, it usually means it's not in the organ where it started, so it's not just in the lung for Maria's case, it had gone to her brain as well.
Oh my gosh. And is it in remission or is it continuing to progress? I don't know if Maria, do you want to answer that one?
Well, I have some brain metastasis. I have fiber knife in my brain. And now I take a target therapy that it goes to all my body, and it gets the cancer away or.
So it sounds maybe there's a little hope. Doctor, is the treatment that Maria is getting something that is relatively new?
Yes, it is. So Maria is receiving a treatment called targeted therapy. It's a pill that she takes every day, and she has been on it for a little bit longer than 2 years. Let me paint a little bit of a picture because you can't see her, but she's here sitting with me. Her husband is across the room, and they look great. I'm actually quite happy that by coming to do this piece with us, they'll be able to have a little bit of a vacation without the kids. So
nice.
And Maria looks just like a normal person you would cross paths with in the street. So she has her makeup on. She's a beautiful Hispanic woman.
Nice.
And she's just leading life as normal as she can, and she's enjoying time with her family, and her family is enjoying having her around.
Wow.
So it's a shame that you can't see it, but you would never think that she has lung cancer, and that's the new face of lung cancer. We have patients that even though they do have advanced disease, they have benefited tremendously from these new treatments. And these new treatments include not just targeted therapies, but also immunotherapies. And what these are medications that we have developed over the last few years. The targeted therapies have specific molecular changes in cancer cells that they target, for lack of another word, and block. And by doing that, they help us control the disease. And because these targets are not as common in normal cells, these drugs do not come with a lot of side effects. They do have side effects. Anything we do actually has unintended consequences, but they do have a lot fewer side effects than older chemotherapy, so patients have a much better quality of life and live much longer as well than they did on older therapies. Immune therapies are slightly different in the sense that they do not target the cancer cells themselves, but actually makes our immune system and our defense cells actually recognize and kill cancer cells, and that's how they actually help patients live longer and also with better quality of life because immunotherapies have fewer side effects than classic chemotherapy.
When a person goes in for their annual physical, whether you're a male or a female, Are you checked for lung cancer, or is that something that you have to request?
So today we do have enough evidence to recommend that those of us who smoke or older than 55 and have smoked for longer than a number of years and have smoked more than a packet a day, or even if we quit smoking within 15 years, we should actually do a screening test, which is kind of like a mammogram for lung cancer called CT scan, and this is a low-dose CT scan of the lung, low-dose radiation CT scan of the lung. And what it does is that it helps us find lung cancers at a much earlier stage. And today, we only know that these patients who have smoked and are older than 55 have a risk that is high enough for us to merit and to make sense to do the screening. But if you have any symptoms such as cough or trouble breathing or pain in your chest, especially symptoms that do not go away after a few weeks, you should definitely talk to your doctor about getting a chest x-ray or maybe a CT scan of the chest.
Can I ask you to explain the metastasized science a little bit for the layperson, for me, basically? When we hear that lung cancer has metastasized to the brain, in this case, is that different than brain cancer, or is there even such a thing as brain cancer? Like when you hear breast cancer has metastasized to another part of the body, I'm a little bit confused. Is the other part of the body, does it get a new name, or is it still breast cancer?
That's a great question, and that's a question that patients ask us very often as well.
Uh-huh.
So we keep calling it by the name of the organ where it started. So if it's a lung cancer that went to the brain, we call that a lung cancer with brain metastasis. If it's a cancer that started in the brain, we would call that a brain cancer, and those are different. And the reason it's important is because different types of cancer respond differently to different types of treatments. So it's important that we know where it started. And we're getting even a lot more detail today, not just about the organ where it started, but what is the makeup in terms of the genetics of that tumor. So we have genomic tests that can tell us if this tumor has mutations, if it has specific targets that help us choose the best treatment for that patient at the moment that we're seeing him or her.
And Maria, when you go through your day-to-day activities, how do you keep yourself up and perky for not just yourself but for your family?
Well, I tried my best. I had my right lung removed, so I only have one lung, so it's harder for me. But I try. I know it's after the bad news, there's hope with target therapy and the genetic test. So I just keep going, and I hope that this medicine helps me, and I hope that with research and donations, we have more medicines for me and for everybody else that is dealing with lung cancer.
Dr. Lopes, do you have information for our listeners, and that would include the doctors as well? I'm always confused when we do these interviews if we're talking to the audience at large or doctors specifically. Do you have a website that they can go to, or a phone number, something they could call or look up?
We do. So there's a number of websites. The one I'm going to be giving you today is the one for the Lung Cancer Foundation of America, which is lcfamerica.org, lcfamerica.org for Lung Cancer Foundation of America. And at that website, you can find a lot of information on lung cancer, what targeted treatments are, what immunotherapies are, and most importantly, it also tells you ways of how you can help us in this fight by donating so that we have more funds for research. Unfortunately, as important as lung cancer is in the number of deaths that it causes in the country, it still receives a lot less funding for research than a number of other diseases out there. And not that we shouldn't fund those diseases, but we should also get more money so that we can learn more about lung cancer, so that we can have more miracles, such as having Maria here 2.5 years later after having a stage 4 lung cancer, leading a nearly normal life. So we need your support. Anybody that can go to lcfamerica.org and learn how you can donate and support research, our research mission and projects that are going all over the country and all over the world, actually, we would sincerely appreciate that support.
To put the miracle word into perspective, would Maria be here if she was diagnosed 10 years earlier?
I do not think so.
See,
Yeah.
that's what
That's what my doctor said.
Wow.
And doctor, how do you gently tell a patient that they have lung cancer and then help them through that initial reaction?
The most important thing is to keep the hope. Of course, you have to be as truthful as you can with what it means to have metastatic lung cancer. But it's amazing how much things have changed over the last few years. And truth be told, we don't know how long a patient with lung cancer who gets diagnosed today will live. Number one, because each patient is different. But number two, because with all of the new advances that we are seeing coming out on a monthly basis, we're truly hoping to keep pushing the envelope so that patients can live for years rather than the months that they used to live for 10 years ago.
It's amazing, and I always hope that there will, because we do the news in this radio station as well as the interviews, and I'm always hoping one morning we're going to put the news together and there's going to be a headline: "Cancer has been cured."
Yes.
That's what we all hope for.
Dr. Gilberto Lopes, thank you for what you've chosen to do with your life. You're making our world a better place. And Maria, thank you so much for being on the air with us. It sounds like you are a strong lady. Thank you. Thank you for sharing it with us.
Oh, thank you.
Yes,
Thank
yes.
you.
Thank you, guys.
Thank you. All right, we'll be right back.
Broadcasting from the Paddock Mall Studios, this is WOCA, Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM, The Source.
Fox News Radio, I'm Chris Foster. President Trump meets with Russian President Vladimir Putin on July 16th in Helsinki, Finland. That announcement this morning from the White House.
The two leaders, according to the statement, will discuss relations between the U.S. and Russia and a range of national security issues. This will be the first summit between the two presidents